in new machinery is how we're going to do it.
Coyle.
Number 11, please, Mr. Speaker.
Mr.
Thank you very much, Mr. Speaker. We've expanded access to PrEP, so everyone who needs it should have access. Thousands more places remain available on the trial. We're working closely with the NHS and Public Health England and local authorities who have to play their part to plan for a seamless transition from the trial to routine commissioning from April next year.
Coyle.
The Secretary of State gave a personal commitment that the PrEP trial be extended. He has failed to meet that commitment, and men have contracted HIV as a direct result of the government's failure. So what faith can the people who need PrEP and organisations like Terence Higgins Trust and the NHS and councils have that the government's national programme will be ready and able to meet the demand that exists?
Mr. Speaker, this is a really important issue, and I care very much about getting this rollout right. And so I would just slightly chastise the honourable gentleman for his tone, because the Minister met the Terence Higgins Trust yesterday. They agree with the approach that we're taking, because the rollout from a trial to routine commissioning will happen in April. Now, there are some gaps where local authorities need to do more, but there are thousands more places available on the trial from the NHS perspective. So if he feels strongly about this, as I do, he should be working with us to get local authorities to do their part, because the NHS is doing its part.
Congratulate the Secretary of State on setting the 2030 target on HIV infections. Access to PrEP, but also, critically, healthcare professional time is vital for reducing new infections. Does he therefore agree with me and the Trust that we must do everything to remove the funding and the logistic obstacles that are discouraging clinics from filling the many places that are now available on that trial?
Mr. Speaker, I wholeheartedly agree with my right honourable friend, who is absolutely spot on about this. And it's broader. Yesterday, there is further that we need to do in terms of ensuring that health inequalities of people who are homosexual or LGBT across the board need to be reduced. We've got a whole plan to make that happen. She played an important part in it in government, and I will rest at nothing to make sure that we address these problems. But we shouldn't engage in the sort of...
Darren Hodgson.
Thank you, Mr. Speaker. I hear what the Secretary of State has said, but data from the British Association for Sexual Health and HIV has shown that 9 gay and bisexual men in Greater Manchester were diagnosed with HIV whilst waiting to access the PrEP trial. Now, this is likely to be just the tip of the iceberg, and the number of people who have acquired HIV because they could not access the trial. So he will agree that this is totally unacceptable and goes against the government's own commitment to eradicate HIV by 2030. So does the Minister agree with me that PrEP should be routinely commissioned before the trial ends in September 2020, and will he commit now that this will happen?
We are switching to routine commissioning from April. It is a deep frustration of mine that some local authorities are not putting in place the measures they need to put in place. I'll look into Manchester in particular. I didn't know about that example. I personally set the goal of 2030 being HIV-free by 2030. I'm delighted, along with support from the member for Portsmouth when she was the Minister for Equalities. I'm delighted that we have made the progress that we have. I have absolutely no doubt that there is further road to travel on this, and we should all come together in support of equalities in health provision, especially in this area, and I look forward to working with her and all those who are on the side of trying to make this change happen.
Tommy Shepherd.
I'll find words.
Where is young Shepherd?
Come on, Shepherd.
He's withdrawn. Oh, I wasn't advised of that. Never mind. He's the most active beaver in the chamber in normal circumstances, so it doesn't matter that he's not here because Mr. Andrew Rosendale is.
Yeah.